Good. Well, good morning, everyone. Welcome. Welcome to the University of UPEI alumni. There's many people here to recognize. And first, I want to start with former senators, and we appreciate your attendance. Also, representatives from the university, others, media. Good morning, and thank you for joining us for this very important funding announcement for the University of Prince Edward Island. My name is Heath MacDonald. I'm a member of Parliament for Malpeque, for the many of you don't know me, and I will be the MC for today's event. I would like to acknowledge that the land on which the announcement is taking place is the traditional territory of the Mi'kmaq people. And obviously we're joined by some wonderful individuals here today, colleagues and former colleagues, and we're expecting some great comments from each of them. So first of all, I wanted to thank the Minister of Finance, Chrystia Freeland, for breakfast this morning. I appreciate that. It was Eggs Benedict, yes. Yeah. And the Honourable Dominic LeBlanc, Minister of Intergovernmental Affairs and Infrastructure and Communities, for being here this morning, coming across the bridge. That's great. Dominic's riding and my riding are joined at the hip by the Confederation Bridge, so we tend to be fairly close. The Honourable Dennis King, Premier of Prince Edward Island as well, taking time out of his busy schedule with the Canada Games. And Sean Casey, Member of Parliament for Charlottetown. Bobby Morrissey, Member of Parliament for Egmont. My colleagues, my former colleague, Honourable Ernie Hudson, Minister of Health and Wellness. And my former colleague, Honourable Corey Deagle, Minister of Transportation and Infrastructure. And of course, Dr. Greg Keefe, Interim President and Vice Chancellor of the University of Prince Edward Island. Thank you for being here. Our government is working towards building a better future for all Canadians. As we look to build this bright future, we continue to make strategic investments in infrastructure and develop dynamic, sustainable communities. Today, we are proud to be supporting a project that will deliver just that for the residents of Prince Edward Island. And, moving forward, today's investments will strengthen our future. With these investments and what will take place for future generations, for many individuals, families, and residents of Prince Edward Island. It's such a strategic investment. We're looking forward to hearing comments from first, the Honourable Dominic LeBlanc.
Oh, you forgot Natalie? Okay. See, okay, so this is what's going to happen, right? You want to be able to blame the guy that spoke before you for having botched the introductions. Anyway, Roger, thank you for, I'm sorry you missed Natalie, but I'm very, very happy to be here. Alors, bonjour tout le monde. Good morning. Heath, thank you for the introduction. Premier, it's nice that you showed up here with your entire cabinet. I'm particularly happy to be here with my buddy and my colleague, our Deputy Prime Minister and Finance Minister, Chrystia Freeland, and obviously my colleagues, Bobby, Sean, and Heath from the House of Commons. I'm glad to see former colleagues who served in the other place in the Senate with us here this morning as well. Lawrence McCauley would have obviously wanted to be here, but he's on his 26th visit to Europe this year. So Lawrence is not able to join us, but he is obviously very excited and supportive of the good news that all of us are sharing with Islanders and for Islanders today and for Atlantic Canadians. Chrystia, I wanted to say I spoke to Chrystia at about a week ago, and I said, Chrystia, what time is it in Bangalore? Chrystia was in India, in Bangalore, at a G20 meeting. It was 4:30 in the morning. I was driving back, actually, from the meeting we had about healthcare, Dennis, a week ago on the island here. And Chrystia and I were talking about a bunch of issues that she was working on at 4:30 in the morning in India. It was 7:30 in the evening driving from Charlottetown back to Moncton. So Chrystia, there's no direct flight on PAL Airlines, I think, from Bangalore to Charlottetown. But it's terrific that so quickly after such an exhausting trip that you came to Atlantic Canada and to PEI. And it means a lot to me, and I know it means a lot to our colleagues as well. As Heath said, we are here to share what I think is a terrific announcement, both for the University of Prince Edward Island. And Dr. Keefe, thank you for your presence here, and thank you for the extraordinary work that you and your colleagues do at this great university. Investments in infrastructure can obviously have far-reaching impacts in communities big and small across the country. Not only do they improve the quality of life and the well-being of Canadians, but they're vital to our economy. They're vital to the social and public infrastructure necessary to keep communities safe and healthy. And infrastructure should and can be a key part of delivering better, state-of-the-art, accessible healthcare services to Canadians. So that's why I'm proud to announce that today, the Government of Canada is investing $9.5 million to construct a new health education building that will be the home to the new Faculty of Medicine at the University of Prince Edward Island campus. Au nom du gouvernement canadien, je suis très heureux d'être à Charlottetown ce matin pour annoncer un investissement fédéral de 19,5 millions de dollars pour construire la nouvelle édifice de la Faculté de médecine ici à l'Université du Prince-Édouard. Beginning in 2025, this state-of-the-art facility will provide clinical opportunities for medical students, while also improving access to primary care for Islanders. And Premier, this is something that your government has consistently raised with us in the very constructive and positive conversations we've had around the healthcare accords that we've been arriving at over the last number of weeks. And I want to salute your leadership, Dennis, nationally, at the Federation, at the Council of the Federation, in getting the country to a better place in terms of delivering high-quality, accessible healthcare services to Canadians. And the premiers from smaller jurisdictions like Prince Edward Island or my province, neighboring province in New Brunswick, were very effective at advancing the argument that the investment should recognize the needs of smaller jurisdictions that have to deliver specific services and can't benefit from economies of scale, have different rural or demographic challenges. So I think we found the right way forward, Dennis, but your leadership was important nationally in this regard, and I wanted to highlight that today. The program offered by the University of Prince Edward Island will seek to improve access to community health care services for more than 10,000 Islanders a year. This investment is significant for Prince Edward Island's healthcare system. The lessons learned in the classroom here at the University of Prince Edward Island will yield results and benefits for all Canadians, but obviously most importantly, Islanders. Ensemble, nous créons les conditions gagnantes qui permettront à la prochaine génération de travailleurs de santé d'exceller dans leur domaine et de mieux servir leurs patients. This partnership between Memorial University and the University of Prince Edward Island is a perfect example of the kind of model that will deliver better healthcare services to Canadians in every part of the country. Dennis, Premier Furey spoke to us. He, of course, is an alumnus from Memorial himself. He is very excited by the possibility of Memorial University collaborating with UPEI and creating this facility to serve Islanders and Atlantic Canadians for a long time to come. So I think today's investment, in conclusion, speaks to certainly our government's desire to partner in the infrastructure space with provincial governments, with higher education institutions, and there's no better example than this great university here on Prince Edward Island. And we have other plans perhaps for other post-secondary education institutions on the island in the coming weeks as well. This will be a leading-edge net zero facility that will probably comprise over 133,000 square feet over 5 stories. So this will be an important building for the university, for Charlottetown, and I think for training the next generation of healthcare professionals that will serve Islanders and all Canadians. And finally, I remember the first time I heard about this terrific project was when Bobby and Heath drove over to Shediac the early part of last summer. We had a conversation at my constituency office. We talked about the potential on the island for this investment. Later in the summer, we visited with Sean the facility here. Sean spends most of the summer in Europe, so he wasn't at the first meeting in Shediac. He was probably in the south of France for July and a good chunk of August. But the first time I heard about this was at a conversation with my colleagues from the island in Shediac. I came over a few weeks later. We met with people from the university. And then when Premier King and I talked about how we wanted to see the federal provincial infrastructure envelope allocated, it was an easy partnership with a provincial government that's been helpful to us in so many ways. And today is, frankly, the beginning of this very happy story together. And I thank you very much for having invited me to be part of it.
Thank you, Dom. Always interesting comments, but you know, look, you know, after that day we met in Shediac, he didn't take me to breakfast, but that's okay. But you know, yes, but the time that it took to turn around this file, I've been in government for a few years now, and I must say to you and our next speaker, thank you on that behalf, because the turnaround time on this file was expeditious. And we appreciate the cooperation and the collaboration. Thank you. Now I'd like to introduce Minister Freeland, who bought me breakfast. So there you go.
Okay. Thank you, Malcolm. I may not need an introduction, but I benefit from a step, I guess. So thank you very much, Heath. It's really, really great to be here. I was on the plane flying from Toronto last night, and I got to chatting with the people sitting around me. Some of them recognized me, but the lady right next to me didn't. And she asked me where I lived, and I told her Toronto. And she said, "Why'd you live there? You should live on PEI. It's great." And I have to say, being here today, I understand why she said that. And it is really, really a pleasure to be here. Obviously, great to be here with Dom, great to be here with our wonderful PEI caucus, with Heath, with Sean, with Bobby, and thank you very much to our partners in the provincial government, to Premier King, to Ministers Hudson, Deagle, and Jameson, and also to our senators, our retired senators. It's really, really great to have you here. And really great to have the leadership from UPEI. This is a great day for the island. It's a great day for Atlantic Canada. And that's really ultimately because of you, the work you've done, and the work you're going to be doing in the future. And I myself, you know, come from actually a much more remote community than Charlottetown. And I know how important it is to be able to have the education so your kids can stay home and get the training they need, and so you can have the professionals your community needs. And so I think this is going to be really a generational project. I think it's going to change the lives of a lot of families and a lot of people, and this is really about building for the future. So I'm really, really glad to be here. Nous nous retrouvons dans une situation où le système public universel de soins de santé du Canada est soumis d'énormes pressions, tant ici sur l'île que dans tout le pays. Nos problèmes existent depuis de longtemps, et la pandémie n'a fait que les aggraver. Un système de soins de santé publique robuste, fiable et universel est au cœur de notre identité canadienne. Et c'est ce que les Canadiens et Canadiennes méritent. C'est pourquoi l'annonce faite récemment par le ministre Leblanc est si importante. That's why last month our government unveiled a historic plan to strengthen public health care across Canada. All told, our plan will deliver $198.6 billion in additional federal funding for healthcare over the next 10 years. So just think about that number. That's almost $200 billion. That's a lot of money going into our healthcare system, and it's a good investment because we need our healthcare system. I really do believe it's something that Canadians are rightly proud of, and we need to invest in it to make it fit for purpose for today. I really do want to say, Dom, Minister LeBlanc, as we have been reminded today, he's a very funny guy. He is fun to spend time with. And I think sometimes he's so fun to spend time with, it's easy not to really appreciate what he's accomplishing, even as he's telling some good jokes and making us all have a good time. When I look at how this federal health care plan has been rolled out at the unprecedented speed with which we now have agreements across the country, it really makes me proud to be Canadian. It gives me confidence that our country does work, that we are able to work together and we're able to invest in something so precious, our healthcare system. And it makes me really grateful to my colleague, Dominic. So well done, Dom. And it also really makes me grateful to our provincial partners. Here on PEI, this agreement is going to mean over $1 billion. $1 billion. That's a lot of money in additional federal health care funding over the next 10 years. That's going to mean better healthcare data and better health outcomes for islanders. It's going to mean better support for healthcare workers here on the island and across Canada. It will mean better access to quality, timely healthcare across PEI. It is going to mean new healthcare funding. And on top of all of that, we have a new medical school here on Prince Edward Island. Yeah, it's a great thing. And I just want to be sure we all get the numbers straight. Sean wanted me to underscore, because he was listening very attentively, it's $19.5 million from the federal government invested in this important effort. And this kind of work, this kind of real generational investment, doing something really concrete and specific, which all of you know this is what PEI needs. And I think everyone here understands the real benefit is going to be for our children and even our grandchildren. And that is what good, smart, responsible people do. They invest today for something that is going to help us in the future. And I really believe this kind of announcement, which is the culmination of some work and really the starting gun for a lot of work here at UPEI, we're able to do this when we as a country understand that everyone needs to work together. The federal government, the provincial government, people in communities, university leaders. And I do want to take a moment to really thank Premier King, his colleagues, one thing I think we all learned during COVID is Canada can be really strong and effective when we remember every single person who is elected in the country is elected by the same people. We're elected by Canadians. And once we get past election night, our job is to forget about all that partisanship and just try to do a good job for the people who gave us the privilege of serving them for a while. I just want to point out that, we are not perfect. No one is perfect. For sure, no cabinet minister is perfect, and my husband and children would give you lots of evidence of that when it comes to me. But we did, as a country, really a remarkably good job during the pandemic. It was really hard. A lot of people made sacrifices. But there was a study published by the Canadian Medical Association Journal last summer. And I think it's an important one because what they calculated was that if Canada had had the mortality rates of the United States, not very far away, a country we're very familiar with, an additional 70,000 Canadians would have died. So think about that. That is more than the entire population of Charlottetown. Whenever I think about that number, I think about my dad and my aunts and all the older people in my life, because those are the people, some of them wouldn't be here today. And so I really want to take this opportunity to thank everyone who made those sacrifices, and above all, to thank the healthcare workers who really made it possible for us as a country to get through, save a lot of lives. Now, it was expensive. During the pandemic, the federal government provided 8 out of every $10 that was spent across the country to support Canadians and Canadian businesses. That was absolutely the right thing to do. It helped us achieve some pretty remarkable healthcare outcomes, and it has also laid the groundwork for a strong recovery from the COVID recession. Canada had the strongest growth in 2022 in the G7, and the IMF predicts we will have the strongest economic growth in the G7 by the fourth quarter of this year. We have near record low unemployment. There are 800,000 more Canadians working today than before COVID hit. That is a 126% jobs recovery compared to 112% in the United States. So that's a big deal. That's because of everybody here. People are working hard, and I'm very grateful. Something else that we've done, also in partnership with Premier King and his team, is created a national system of early learning and childcare. That I hear all the time from Canadians, mostly, to be honest, Canadian mothers, how that has changed their lives. But you know what? As finance minister, I can tell you it is changing our economy too. Part of the reason that we have this strong economic recovery, part of the reason we have such strong labor force participation is parents, in particular mothers, can now go and work if they want to. And today, Canada's labor force participation rate for women in their prime working years in January was 85.6%. It's never been that high. And at a time when a lot of business people talk to me about labor shortages, how that is holding them back, isn't it great that mothers in our communities can get a job if they want one and be confident that their kids are being taken care of, and not just being taken care of, are learning in great, great environments. So I really do want to thank the government here in PEI for working with us on that. And you guys have been real leaders in early learning and childcare. So look, in conclusion, really, really glad to be here. Grateful for the cooperation, grateful for the hard work of Islanders getting through COVID and now positioning us for a really, really strong recovery. Today's announcement, I think, is another example of what we can achieve when we all work together. And I'm very much looking forward to continuing to work with all of you, with the provincial government, with my PEI colleagues, to continue building an economy that works for all Canadians. Merci beaucoup.
Thank you, Heath.
You didn't need this.
No. And thank you, Minister Freeland, for coming today. And it's nice to see, without you here, we were only going to get 9.5 million. So, and then.
We could just do 9.
No, we'll take the near 20. Thank you. Thank you, and good morning, everyone. And on behalf of the province of Prince Edward Island, I'd like to thank you all for joining us today. We are pleased to have the Honourable Chrystia Freeland, Deputy Prime Minister of Canada, with us today. Deputy Prime Minister, we welcome you to our province and thank you for the federal government's continued support for initiatives that are important to all Islanders. And I'd also like to welcome Minister Dominic LeBlanc to PEI as well. We first met back in November in Moncton for FPT meetings, and we always appreciate a visit from our neighbor from across the bridge. So very, very pleased to have you here today. And I think it benefits PEI that our federal Minister of Communities and Infrastructure is from the Maritimes. And I think we've certainly seen that in his support. And I know that your understanding and respect of our region will serve PEI well as we continue discussions on future infrastructure programming. And as we work to address the potential impacts of climate change and support the quality of life of Canadians, I will continue to advocate for infrastructure programs that are fair and equitable to smaller jurisdictions like Prince Edward Island. I feel that I have a willing partner on that, and I know our island MPs are also advocating strongly for PEI, as Bobby Morrissey did just 20 minutes ago, already putting in his paving requests. They never. And whether it is school or healthcare facilities, roads and bridges, public transportation, storm and wastewater improvements, or investments in our local rinks and recreation facilities, our joint investments in infrastructure make a huge difference. And today's announcement is another step to strengthen Prince Edward Island. And with that, I would like to introduce the Premier of Prince Edward Island, the Honourable Dennis King, to announce the provincial investment to this project. Thank you.
I heard that. He said something about don't use the stool. I don't think it can hold him, I think is what he was saying. I used to be 6'2", but then my sides gave out. Thank you very much. Thank you very much. That's my brother's joke, by the way. So I want to say thank you, Corey, for the introduction, and welcome to Chrystia. Thanks for being here, for your kind words and your great leadership and partnership through some difficult times. I remember the first time you came into my office and we sat down and met, and I think you were having a spirited discussion with a colleague of mine who shares a certain shade of color with me, and made some kind of comment about it would be nice to find somebody who we could work with, and I think ever since then we've worked well together. So thank you, and thank you for rounding up that check. That's very important. We just would have called Lawrence anyway and straightened this out. But I also want to say to Dom, I think Chrystia is very right. Dom does tend to undersell a little bit the value of what he's brought to these projects. I know just our recent project with the BioAccelerator, for example, and some of the other projects that we're working on, they don't get over the line easily. And not that we need to get into a big, long conversation about the federal infrastructure programming, but it doesn't always fit a perfect box for a small jurisdiction like Prince Edward Island. But somehow through it all, through the length of this project, I think we're the only province who spent all of our infrastructure money. So that's because we're very creative. So yeah. And that's in no short order and measure to our MPs, who are also tremendously helpful to get projects introduced and not just shoved off the table because they might not initially meet the basic criteria. So I've enjoyed a very strong relationship with Bobby, with Sean, with Heath, and with Lawrence, and I think it really bodes well. And I think the fact that in the last couple of weeks there's been, when you add up the health money and the BioAccelerator and others, we're probably in excess of $1.5 billion of federal money that's come to PEI. So I would be billion. So I would say, on behalf of all Islanders, thank you very much. Thank you. I also want to, well, I didn't even count that. So. But it's great, and I also want to, my colleagues who I work with, I think we can all relate to the fact that sometimes it's me because I'm the Premier who stands here, and Dom has said some nice things and Christy has said some nice things, and that's wonderful. But we have a great team, and I think when you look at this project and realize this is an infrastructure project that involves Corey and his department, this is an educational institution that's going to require the financing and leadership of Natalie's Department of Education, and of course health and wellness with Minister Hudson. All of these individuals and their staffs and so many others have worked so hard to get to here. So I want to make sure that they get the recognition that they deserve, because we wouldn't be here without them. So thanks to you. And I also want to say to Greg and the leadership team here at the University of Prince Edward Island, I really do think when this was first introduced to me, I think this is a visionary project. I think this is something that we all wish could have been done 20 years ago, and this is very much an investment in our future. It's taking a little bit of control of our own destiny in terms of how we teach and how we learn and where we teach and where we learn, that will pay off dividends into the future. But it's a visionary, it's a courageous project. Anytime we try to introduce change in this world, in this province, we know there's some challenges that come with it. I used an example the other night when I was speaking to a crowd that when we introduced the Confederation Bridge, not everyone jumped up and said, "That's a wonderful thing." Why, gosh, that's a great idea. But I don't think too many Islanders would want to send it back now. So I think you have to look at these things in terms of, and I think even this institution which we're in, when Alex Campbell amalgamated St. Dunstan's University, which was the Catholic university, with Prince of Wales College, which was a Protestant institution, and brought them in to UPEI, I don't think everyone thought that was a great idea. But I think it's really, we have built one of the great institutions in the country and something that we're all very proud of. And I think this project is along that scale. I know there are many challenges along the way, some we know now, some that we will encounter, but this is a courageous thing to do. It's the right thing to do. It's going to change and adapt our system, which we need to do. And I'm just really, really proud of Greg, of your team, for having the vision, the foresight, the determination, the courage to do this. And I'm very, very honored as part of the government of PEI to play a role in this. I also wanted to recognize a couple of colleagues in the front row who have been recognized as former senators, which they are, but we also have former Premier Catherine Kobuk, who's also the Chancellor of the University of Prince Edward Island, who's played an important role in this. Catherine came up to me when we were talking about the university, and she said, "This is something that you'll be proud that you did." And Premier, I can say I am very proud that we've done it, so thank you for your leadership and your advice along the way. And of course, recently retired Senator Diane Griffin, who is now the chair of the Health PEI Board, which is something that I know that she's going to make she's already made a tremendous difference and contribution, but I'm really, really excited for her leadership, her community-minded vision, and her love of PEI, and her ability to work with people. So I'm really, really excited to have you there, and this is going to be a big part of your legacy when you're finished as well. So thank you very much for I feel like I should stick to my notes, but I've skipped. And Dr. Dickerson, I want to also mention, because Herb Dickerson has been a big figure in our province for many years, and he's been promoting an institution such as this since I first got to know him in the middle 1990s. So I hope that you're proud that your legacy is part of this as well, and your vision. So thank you for being here as well. This is wonderful. So since the announcement of the university's School of Medicine in 2021, all of our partners have been methodically going about the planning process to deliver a state-of-the-art facility where doctors and nurses will be trained and where over 10,000 Islanders will receive care from a team of healthcare professionals in what we call a patient medical home. The infrastructure required for this project is just as important as because it will happen in just a few short years, and we've already broken ground just outside of this facility here. As it has been previously announced, this facility will be a state-of-the-art build, implementing the best new practices for how we teach and how students learn and how patients want to receive healthcare in today's world, and the training of our healthcare leaders of tomorrow. The infrastructure cost alone will be somewhere in the vicinity of $50 million, and with the help of our friends in the government of Canada, with their announcement today, our new funding contribution on behalf of the province of Prince Edward Island will be $16 million, which will be on top of the almost $20 million that's being injected here by the federal government. And I think it's also important to know that while this facility will be housed here at the university in Charlottetown, this partnership allows us to focus more as a province and to focus more financial resources on preparing our health system for the future as we change and adapt, improving our hospital facilities across PEI, the Queen Elizabeth Hospital, the Prince County Hospital, Western Hospital, Kings County Memorial Hospital in Montague, and so many other things that we will be doing now that will be needed as before we begin the process to accept our first cohort of students. As I said before, there was a time when the idea for a medical school on PEI was maybe thought to be impossible, but you didn't think so. And thankfully, the university didn't think so either. But over the past little while, we've learned that we're in a tremendous time of change in our society, and nowhere is that more evident than in healthcare. What we're doing in terms of adapting and changing our system is much needed, not just for the patients who access the service, but for the high-end and wonderful professionals who provide that service within the system. And that's why the system needs to change, and that's why we're in this period of change. That's why we're working on things like patient medical homes and trying to have a collaborative center of service for healthcare professionals. When you talk to healthcare professionals who are graduating school, they want to work within a collaborative system. The days of a family doctor working in rural PEI having 35,000 patients and doing house calls are long gone. They want to work within a collaborative system of delivery, and that's what we should want as people as who access the service as Islanders. Primary to everything is access to service. I think you hit it on the head, Christia, is what we need is access to quality service. And there will be a family doctor along the way, but there will be nurse practitioners, there will be RNs, there will be RCWs, there will be social workers, and there will be a conglomerate of services within the healthcare system that will be there for you, for the service that you need as close to home as you need it. And as I said, there'll always be bumps in the road, and we can't be afraid of those. But by the time we open the doors of this Faculty of Medicine, we'll be ready, we'll meet the expectations, we'll exceed the expectations, and we will be on the pathway to a drastic change that is needed in healthcare and which will serve Islanders well into the future. One thing that I'm also certain about, and I think I spoke in depth with Minister Hudson and with Minister LeBlanc and Minister Duclos last week when we renewed our Canada Health Transfer Agreement, which has been announced $1 billion over the next 10 years. I've said before, it's not all about money. It's not just money that will change our system, but money will help as we adapt, as we broaden the scope of practice for those within it. It's going to take money as we innovate our services. It's going to take money and investment, and that's where I think the federal government has gotten this right from the very beginning, is that the conversation with me, at least, has always been about what can we do to help adapt and change the system and to make it more accessible for the people who need it. And I think think that's what the $1 billion does for PEI in the long run. But it's not just about money. It's not about politics. It's about trying to provide the best service that we can provide to citizens as close to home as possible. And as I say, for the people who access the service, but also the ones that work within it. This is a step in the right direction. It's a very exciting day for PEI. I'm very grateful for the relationship and the partnership that we have built with the federal government through our members of parliament here. And I also want to, just before I close, I don't want Bobby and Heath and Sean to sell themselves short. It was a little bit more than just a trip across to Shediac. I think when the announcement first came, there was conversations that began with me and some of my colleagues to say, I think there's a role for the federal government to play here with the infrastructure program. I know it doesn't fit right now, but let's find a way to work through it. And I'm glad that trip to Shediac helped, but there was a lot more than that. It was expensive, and these guys, but really, when these guys go to Ottawa with PEI at their best interest, they deliver, and with this project here, you delivered mightily. So thank you very much.
Yes, Dennis, it was a lot more than $20 to cross the bridge that day, I can tell you that. Without further ado, and you know, I do have to say, Greg Keefe and Myrtle, Bobby and I had the opportunity to visit St. John's and spend a few days there, and we walked out of there together and we said, wow, we need this. And we pushed pretty hard to get it, and with Sean and Lawrence's help and, of course, our collaboration. But it's not just a training facility. You're talking research, and the economic value to this province from this facility, I believe St. John's, if I'm correct on the number, was like $200 million a year. So we can't forget that as well. So it will have a long-lasting effect, and it will have a trickle-down effect. The next guy doesn't need any introduction in this area, so Sean Casey.
Thank you very much, Heath. Distinguished platform guests who have all been introduced several times now. Ladies and gentlemen, when you see the collection of speakers and public officials here, I'm reminded of something that happened to me about 4 years ago. At that time, I was in the role of Parliamentary Secretary to the Minister of Fisheries, Oceans and the Canadian Coast Guard, a position that was once held by our friend Dominic. But when I was the Parliamentary Secretary, as some of you may know, the job of a Parliamentary Secretary is to allow the Minister to be in two places at once. So I was dispatched as the Parliamentary Secretary to represent the Government of Canada at a graduation ceremony for Coast Guard officers at the Coast Guard College in Sydney. And as all of you here know, sometimes graduation ceremonies can go on quite long. And this one did. And there were many speakers. And one of the, after several long speeches, the Coast Guard College has an affiliation with the College Cape Breton, the University of Cape Breton, or Cape Breton University. And Dr. Keefe and former Premier Colbeck and Dominic would know this, but the president of Cape Breton University was a fellow by the name of Dave Dingwall. So after several fairly lengthy speeches, President Dingwall stands up and he says, "The hour is late, much has been said, and brevity is the hallmark of public speaking." He said about two more sentences, he sat down to thunderous applause. And immediately after him, the Commissioner of the Canadian Coast Guard got up and he said, "The hour is late, much has been said, and brevity is highly overrated." And he proceeded with his 12-page speech. I'll be somewhere in the middle. When we look at the evolution of the University of Prince Edward Island, I remember back to when the introduction of a Master's in Business Administration here at UPEI was a big deal. And it was, and it still is. But now we're cranking out engineers, and nobody ever thought that would be possible. Jean-Yves Duclos was here not too long ago, and the Atlantic Veterinary College is now approved to do COVID wastewater treatment, wastewater testing for COVID, something that will, sustain our resilience for future pandemics and others. And here we are announcing a medical school. I mean, separate and apart from the transformation of this campus with respect to physical infrastructure, the things that are happening here are absolutely remarkable. And so for everyone in this room that is involved in pushing the university forward and is involved in this announcement, take a bow. It's, yeah. And as the Member of Parliament for Charlottetown, I couldn't be more proud of the federal investment that's happening here of late. You look down at a brand new learning center, and Don Allen is beaming with pride over there, I'm sure, that has been so well received. We have a $92 million modernization of the Daniel J. MacDonald building, which is a vote of confidence for the continued presence of the national headquarters of the Department of Veterans Affairs here in Prince Edward Island. We're down to the finishing strokes of a $100 million overhaul of Province House. We had $25 million investment out at the BioAccelerator, something that will contribute significantly to the diversification of the economy here in Prince Edward Island. And this today. So, I mean, all of these things are, they're not designed to solely benefit the island in the term of office of the people that are making those announcements. These are investments in our future. And I think it's absolutely humbling that the government of Prince Edward Island and that the government of Canada have that much faith and confidence in the people behind all of these investments, in the people that are going to make them benefit future generations. And it absolutely affirms my decision to choose public life. Thank you, everyone.
Well said, Sean. And certainly we've known, my colleagues on both sides of this podium have known, and these senators have known, Prince Edward Island continues to punch above its weight, and we will continue to fight for that. So next, I'd like to introduce my driving partner that day to Shediac, and I'm not sure if anybody ever drove with Bobby Morrissey before, but I was exhausted by the time I got home. Bobby.
Thank you, Heath. And he made me pay the toll, Mr. Premier, Mr. Ministers. And that is a project we'll continue to work on. Everything has been said. I want to thank the University of Prince Edward Island and key players. Dr. Keefe has stepped in. Myrtle Jenkins-Smith, who has been part of my political life over the years, for showing the leadership. To you, Premier, for embracing that. And to my colleagues for supporting this initiative. As Minister LeBlanc, my colleague Dominic pointed out, it's the role of politicians who are elected to make sure that the programs designed by the bureaucracy are adaptable to the needs of the community. And you too, Minister Freeland, Minister LeBlanc, you exercise that very, very well. So thank you. Thank you for your leadership. We would not be here today without that. And of course, this will be happening, Madam Chancellor, on your watch. My former boss, Catherine Colbeck, who is now Chancellor. And this will be the third pivotal changing of what is now UPEI. It began with the amalgamation of Prince of Wales and St. Dunstan's University into the University of Prince Edward Island. The second great one was the establishment of the Veterinarian College in 1984. I was here for that, Mr. President. And now today is, as Sean and Heath pointed out, is the third, the establishment of a med school. And to all the naysayers, take a time to look. One of the things that the med school at Memorial did well is they have a wall, Mr. Premier, Mr. Minister, and they have framed all the negative commentary on the establishment of Memorial Med School. And it's interesting to read those, as Heath and I did. But as he pointed out, anybody that was spending time there with the dynamic team, and I must say the three leaders of that progressive university, Madam Deputy Prime Minister, are all women. Dynamic leadership. And one of those is steering this, I was going to say marriage, but it's the wrong term, this collaboration between UPEI and Memorial. And of course, sitting with us today is Dr. Herb Dickinson, and I have to acknowledge, very few of them, that Herb was instrumental in convincing me to embrace the concept of a med school and to get behind it and support it publicly. And that was in 2018. And I remember that. It was a hot July day, and both of us were in Lennox Island attending a traditional ceremony. And Herb, yes, at first I sort of dismissed it, like a lot of people are today. But you insisted on me taking the time to sit down long enough to listen to your pitch and then to explore it, which I did. So thank you. Thank you for that intervention. In closing, I'm going to read, because Myrtle gave me an article this morning when I walked in, Mr. Premier and Ministers. That was a co-op editorial that was written by former Premier Alex Campbell, a visionary leader that was visionary in creating the University of Prince Edward Island. He was a political role model that convinced me that, as Sean pointed out, public life is a noble calling and you can make change. And he wrote in this guest opinion, and it's fitting today, UPEI, it must be considered to be the university of all religious faiths, the university of each and every ethnic group, in short, the university of all islanders. It will be our university and our program for the island, a university that can grow as we grow, and one that all islanders can support, utilize, and cherish. 1,000 stories can be told about the events, frustrations, and successes that have taken us to this time and place. Each story represents a step toward the fulfillment of a dream. To the founders past and present, to the many benefactors, and to the leaders who have tirelessly carried the torch, you have taken the university into the fullness of island life. You rank well among Canadian universities. You attract top students and faculty members. I can note with certain pride the extraordinary progress achieved over the past years, and I would remind ourselves, and this is key, that if the university is to grow as we grow and adapt to the changing needs, then it must have the resources to do so. Today is all about providing the University of Prince Edward Island with the resources to carry it into the next generation students, one that will serve all of Prince Edward Island, which it must do, and one that we Islanders will be extremely proud of for years to come. Thank you for everybody that was part of this.
Thank you, Bobby. Bobby was in the back room and he had this article that Myrtle presented to him, and I said, "You can't read that." It was like a full page of it. So anyway, good job. Next, I'd like to introduce my former colleague, Ernie Hudson. Ernie, we always enjoyed the banter in the legislature and the provincial legislature, and we become relatively good friends. And
Well, thank you, Heath. I thought that introduction was going just great until you used the word relatively. I thought we were good friends. But with that, it certainly is. It's a pleasure to be here with you this afternoon. Ministers Freeland and LeBlanc, it's great to have you here in the island. As I'm sure you know, and as Sean could give you almost a day-by-day update, but we're hosting the Winter Games here in the province. So I would strongly, if you do have the time, Sean could probably take you to some of the medal ceremonies, because as I understand, Sean, you're presenting medals probably 3 or 4 times a day. So he could give you the schedule for sure. Bobby, always great to be in attendance at any event with you. Just a suggestion, maybe yourself and I could get together, compare our paving lists, and then we will get a meeting with Corey.
Good idea. I'll take you up on that.
Okay, sounds good. Premier King, Minister Deagle, Minister Jameson, it's always a pleasure, as I said, to be with you as well. And I want to thank you for the great team that we have put together, working together as a team in partnership on initiatives, not only initiatives such as this, but so many others. And what it comes down to is initiatives for Islanders that not only presently, but for generations to come are certainly going to benefit Islanders. President Keith, again, Greg and I go back a ways, and I don't know if it's the same with, and I do. I have a tendency when I see President Keith, it's always, how are you doing, Greg? And the reason for that, and he may feel the same, it may be rather than Minister Hudson, g'day, Ernie. But the reason for that, a bit of background on myself, I operated a dairy farm up in the western part of the province. And at that point in time, Greg was one of the veterinarians out of the West Prince Vet Clinic. So we got to know each other quite well with that background. And at that point in time, President Keith, I don't know if we ever would have looked into any crystal ball that would have seen where we were going to be in 15, 20 years down the road. Chancellor Colbeck, it's always great to see you. Diane, look forward to a great working relationship with you, and thank you for taking on the responsibility and the vision that I know that you bring with it as the chair of the Health PEI Board of Directors. So thank you. Herb, again, just to follow up, I think, on Bobby's comments. It was probably within about 12 hours after April 23rd of 2019, the election, when I was elected, Herb drops a letter off to me. And that letter is just every reason that we should be moving down this road. So, Dr. Dixon, thank you for your efforts and for your support as we've moved this forward. Thank you. And Sean, you had mentioned brevity. I don't think that this speech is terribly long, so I will ad-lib a little bit. But I also want to recognize Federal Minister of Health, Minister Duclos, who was here just several days ago with Dominic. We had a great meeting, myself, Premier King, as has been referenced, the additional through CHT, Canadian Health Transfer, but more importantly, from my perspective, is the bilateral agreements that recognize the unique challenges that small jurisdictions such as PEI have. And certainly, Minister Duclos has been so accommodating, I would have to say. And starting back in April 23rd, it's been my pleasure to be the co-chair of the federal, provincial, territorial ministries of health with Minister Duclos. Certainly appreciate his efforts and all of the initiatives that we are moving towards. So once again, it is a pleasure to be here as we make another historic step toward the establishment of Prince Edward Island's first medical school. I do, as I've said before, want to thank the federal government for contributing to this very important project. And I also want to thank our educational officials, the administration of UPEI, and their counterparts at Memorial University for making this great, and it is a great development, possible. We expect big things from this school and from the people who train here. I think it is fair to say when we train physicians right here in the province of PEI, many of those new island-trained doctors are going to be interested in building their lives here and building their careers in our province. The island is full of people who came here for a professional opportunity or for schooling and who fell in love with this beautiful province of ours. We know this will work for our new physicians as well. And I don't want to overlook the expanded training opportunities in other medical professions that have just been announced. UPEI is increasing spaces in its registered nursing program, and I want to thank UPEI for working with the government of Prince Edward Island in moving that initiative forward. Holland College is expanding its training of LPNs, of licensed practical nurses. The government of PEI have put in place free tuition for RCWs and additional intakes in the RCW program as we realize the challenges that we have with Health Human Resources and as we move forward on a number of different fronts to address these challenges and to take care of them. Our schools of higher education are taking important steps to train the professionals that we will need in future years. But those investments and that training will take years to fully come to fruition. In the meantime, we want to continue to pursue every opportunity to recruit capable, experienced, qualified professionals for jobs within our health system. And we will work with our staff to make sure that we can retain the skilled workers who deliver health care here in the province of PEI. I know very well that health care issues are at the core of our sense of well-being. Meeting those needs requires financial planning, human resource planning, and facilities planning, which is what we're doing right here today. The investments we do make today will yield benefits for years and decades to come. Benefits and stability, as Minister Freeland had referenced, not just for today, but certainly for our children, our grandchildren, and the generations to come. PEI is not alone in its challenges to recruit and retain healthcare professionals. It is a significant challenge faced by every province right across this country. We will ensure more up-and-coming nurses, nurse practitioners, practical nurses, RCWs, LPNs, and now medical doctors who can be educated and trained right here in the province of Prince Edward Island to join the healthcare workforce right here. Thank you.
Thank you, Ernie. Well said. And now I'd like to introduce maybe not necessarily one of the politicians, but the interim president. When I say interim president, you think of someone that may sit on their hands or someone that, may just go through the motions. Well, let me tell you, when you look, not this guy, when you look at the campus of UPEI and you see the Atlantic Veterinary College, world-renowned training facility for veterans and students from all over North America, maybe even further. Greg Keefe was part of that foundation and built that strong. And then he takes on interim president, and here we are today building a medical faculty for Prince Edward Island. And him and his team, and Myrtle Jenkins Smith, I want to recognize, and some of the other staff are over here from UPEI. Politicians, yes, we go and get the funding and, we negotiate and we collaborate and we do everything possible to bring stuff to our ridings. But you're making history and we're certainly glad to be a part of it, but your leadership is second to none.
Thanks, Heath, and thanks to everyone for the kind comments. Bobby mentioned in his comments the importance of the Vet College, and Ernie alluded to the fact that actually, Ernie, it's probably closer to at least 30 years ago, not 15 or 20, but we had a lot of great conversations with Ernie and I, well, I had my hand somewhere inside a cow. You can have some interesting conversations during those meetings. So I am a veterinarian, and I have been at the Atlantic Veterinary College now for 27 years and 7 years as dean, and I appreciate the acknowledgement of the importance of AVC to PEI as well as this new initiative. I do have some notes. I haven't spent enough time with David Dingwall yet, so I do have some notes to convey, and there's certainly lots of thank yous to give. But first some acknowledgements. Of course, thank you, MP McDonald, for the very kind introduction. Welcome to the UPEI campus for Deputy Prime Minister Freeland, for Minister LeBlanc, for Premier King, MPs Casey and Morrissey, Ministers Hudson, Daigle, and Jameson. I do want to say a special thank you to someone who's become an incredible mentor to me, and that is Chancellor Colbeck, who I also recognize as a former Premier and a Senator as well. Diane Griffin, the chair of Health PEI, and also a former senator, to deputy ministers that are present here today. Also to members of the steering committee for the development of Faculty of Medicine and the joint medical degree with Memorial University. I want to recognize their presence here today. UPEI vice presidents, the CIO, associate vice presidents, deans, faculty members, and staff. So welcome to everyone to the UPEI campus. I am very pleased, of course, to be part of today's announcement, which supports UPEI in its goal of establishing a Faculty of Medicine leading to a Doctor of Medicine degree. I always stumble on that one a little bit because I'm so used to saying Doctor of Veterinary Medicine degree, but leading to a Doctor of Medicine degree program in partnership with Memorial University of Newfoundland. Our team has worked diligently on establishing the program, and it falls under 3 pillars: accreditation and curriculum, health system integration, and that's a big one that we're working on right now, and of course infrastructure. And today's announcement supports vital infrastructure on the UPEI campus. The university is grateful to both the federal and provincial governments for this infrastructure that will support current and future training needs for physicians, as well, and I think this is important and it's been noted, as well as a variety of other health professionals and practitioners in our community, providing much needed human resources to Prince Edward Island. It's a 5-story, more than 130,000 square foot building, which is being constructed just behind the current building that we're in. It will include an expanded UPEI Health and Wellness Clinic, which will transition to a patient medical home accommodating 10,000 patients. The facility will be a model of primary health care delivery for PEI. Medical learners will train using a collaborative approach with other allied health professionals. Additionally, the facility will feature state-of-the-art simulation laboratories and clinical skills spaces. These facilities will support interprofessional health education programs in addition to medicine, including nursing, nurse practitioner, and the paramedicine program, among others. These spaces will also be available for continuing education for physicians, for other health professionals, and for the broader community. A joint medical degree is a new endeavor in Canada. Initially, the program will be under Memorial's accreditation and transition shortly after, when full accreditation of the joint program is granted by the Committee on Accreditation of Canadian Medical Schools. There's also approval required by the Maritime Provinces Higher Education Commission and the Atlantic Advisory Committee on Health Resources. That is required as well. The program will use Memorial's curriculum as a foundation, but I am proud that UPEI is developing innovative curriculum unique to PEI. UPEI brings a wealth of knowledge and strengths in the area of planetary health, which encompasses ecosystem health, animal health, and human health, as well as nursing, climate change, paramedicine, psychology, veterinary medicine, and other applied health disciplines. Prior to the start of the construction last fall, Mi'kmaq elder Dr. Judy Clark, UPEI elder in residence and a faculty member in our Faculty of Indigenous Knowledge, Education, Research, and Applied Studies, conducted a private sacred pipe ceremony on the site. We are grateful for Elder Judy's guidance, and we are excited to see the progress that has been made since that ceremony was held. I am appreciative of the many members of our university community, physicians, and the broader island community who have been working tirelessly to advance this initiative. Together with our partner, Memorial University, we will support the development of the next generation of physicians for this province. I was happy to share the news of today's announcement with my co-chair on the steering committee, Dr. Margaret Steele, Dean of the Faculty of Medicine at Memorial, and Dr. Kathy Vardy, Executive Director of Medical Program Development for UPEI. Both send their regrets at not being able to attend today, but I can't stress enough how fortunate we are to have such a great partner in Memorial University. Memorial University's Faculty of Medicine has over 50 years of experience training future physicians focused on rural, family, and general specialist practice. Dr. Steele asked me to pass along the following statement. As a partner in this first of its kind joint degree, I would like to thank the Government of Canada and the provincial government of the province of PEI for supporting the future physicians in this province. This new state-of-the-art facility will provide students with advanced learning opportunities in their province and prepare them to excel in their career as health professionals. I echo Dr. Steele's comments, and on behalf of the University of Prince Edward Island, I thank the governments of Canada and Prince Edward Island for these important investments. We are grateful to our federal and provincial partners for placing their confidence in UPEI on this vital healthcare initiative. Thank you.
I guess you can tell who the politicians are. That was the shortest speech, by the way. And likely had the most content. Thank you, Greg. Yeah. Thank you, Greg. That's the ending of today's ceremonies. We're going to do if we can, a quick photo op with dignitaries and the university, and then we'll open it up for